Welcome back. Here we are. This is the eighth and final installment of the value analysis program, and we're going to be focusing on performance improvement. Like I said before, this is probably one of my favorite topics. Performance improvement is really what's going to drive your program. And not only that, but when I say people have expectations of you and you're setting expectations, they're typically going to be looking for your performance improvement plan as a way of achieving the specifics of those expectations. So this is really a key piece of it. There's a lot of different ways to do it. I'm going to show you one way to do it, and I hope this will be helpful for you in terms of developing a plan for your performance improvement plan. So there's really sort of two general types and then some specific types, and we're going to go into the general types. And there's project improvement and then there's program improvement. A project improvement is just that. You have a simple project that you're working on. You want to change something from A to B, and you'll get better savings with that, so that's your project. Program improvement is a little bit different. Program improvement is how are things changing in the program over time. And so maybe the first year you take on two projects and one of them successful and the other isn't. The second year you take on 6 projects and 5 are successful and 1 isn't. So that's program improvement. You've taken on more projects and you had a greater success rate with it. And so the two have to be, I think, very clearly delineated so that you understand it. Sometimes people get the two mixed up. They'll be asked about their program improvement and they'll start to describe a project improvement that they've been working on. And really that's not necessarily what program improvement, unless you only have one project, then I guess it is. But you really want to be able to demonstrate that the program is improving over time. And the way to do that, one of the ways to do that is obviously is to show that you've had good project management and that the projects are improving over time as well. Not only that, but it could be something in terms of, say, like we talked about before, succession planning. You could be able to say, hey, yeah, last year we didn't even have a succession plan, and now we do. We've got, a well-groomed succession plan, and we know who would be stepping into if anybody happened to move on or leave the organization for whatever reason. So those are examples of the types of things you could do at program level. We'll talk a little bit more about that later when we get down to specifics of that. The specific types of performance improvement, typically in value analysis, are going to really focus on the first 2 out of the 3, and then I'm just going to touch on the third one as a way of getting at a performance improvement that you're probably not used to, particularly in value analysis. And so contracting is a big one. So just like I gave you the example, you currently have a contract with vendor A. Vendor B comes along and says they can, undercut the price and deliver the exact same performance with a particular product that they have that's going to replace vendor A's product. They come in at 10% lower. That's a 10% savings. That's a pure contracting savings. There was no change or anything there. You just did it purely on contract. Or say you went to vendor A and they were able to meet that. Now all of a sudden, again, pure savings, 10% savings or whatever it is. That's pure contracting. Utilization is a little bit different. Let's say you have a vendor A you're working with, and for some type of surgical procedure, they always use 2 of a particular supply. And some evidence comes along and says that you really don't need to do 2. You only need to use 1. And so you come in and you say, hey, listen, we're going to only use 1 of these particular pieces of equipment or supply when previously we used 2. That's a pure utilization savings. You cut your use by 50% purely by changing your indications for the use in the first place. And so now all of a sudden that's a pure utilization savings. A lot of times though you'll see some sort of mix between the two, where you're getting partially contracting, but a lot of it has to do with utilization. Maybe you're moving from one vendor to another who's at a lower contracted rate, and so you're changing your utilization because you're approaching a different contract that has a lower rate for the use. And so there's a lot of ways of mix and matching these, but it's good to know sort of which one's doing which, because when you're out there asking people for utilization ideas, sometimes they'll come to you with contracting ideas, and it's like, well, that's a contracting idea, and typically we're going to have to take that through our contracts people first. So it's good to let people know that sometimes because someone will say, well, can't we get a better price on such and such? That's my idea for utilization. It's like, no, actually that's more of a contracting idea, and they're already working on that. So just make sure that you have that pretty clear for folks. And the other thing too is that it's nice to know where the savings is coming from. we saw when we developed a utilization program, what we found was that we saw this big, huge ramp up in savings from utilization, and we did that over a couple of years, and then all of a sudden it started to drop off by the third year. A lot of people started asking, well, what happened there? Why was your utilization dropping off? Were you not putting as much effort into it? You're not thinking as much? There's all different types of points of that. And what we found is it wasn't so much that we weren't putting any effort into it. It was just simply that a lot of the sort of low-hanging fruit ideas were used up. And now we're starting to reach into utilization ideas that required a lot more resources. And so you just have to recognize that that's a typical natural thing that's going to happen when you start focusing on utilization. You see this big improvement in utilization, followed typically by some leveling off and even dropping off in performance over time. So it's important to recognize that. I put the last type, the clinical practice, and I'll touch on this at the very end, but there are times when clinical practice can impact value analysis, and for the most part, supply chain and value analysis programs aren't always very aggressive in terms of looking at clinical practices, mainly because it's just not their area of expertise. It typically will prefer physicians and clinicians make those types of decisions, and so a lot of times they won't even get involved in clinical practice changes. But clinical practice changes can have some impact on outcomes, and I'll talk about this towards the end of this particular segment because it's important to understand that those two can count as savings, and they should, and people should get appropriately rewarded for that as well. So I'll bring that up a little bit later. So let's talk about contracting. Start with your contract calendar, and I talked about this in a previous section. Your contract calendar really kind of drives everything in contracting. You may have, we had over 2,000 contracts, and so contract cycles could be anywhere from 1 to 3 years, average about 2 years, but some were on a 3-year contract cycle. So that means 2 out of the 3 years, you won't even be looking at that contract. You won't even be looking at changing anything in the contract. And so, like I said, that comes down to setting expectations, because somebody in your organization might say, well, I think you should look at that. And it's like, yeah, but that's another contract, that we'd have to look at. And if we wanted to really do anything with it, we'd have to break the contract. Breaking contracts is not very cost effective. It's not that you can't do it. It's not that they don't have these things written into the contracts. Sometimes it's you have to give them 90 days or a 30-day notice or something like that you're going to drop the contract. But the problem is you have to have another contract to replace it. You've got to go back and renegotiate. It creates a lot of carrying costs to do that. And so as a general rule, most organizations shy away from it. It also, the vendors try to avoid doing that because they know the same thing. They have contracts with hospitals all over the country, sometimes all over the world. Having people break contracts is not very good for business for them either. So as a general rule, everybody tries to avoid breaking contracts, so we stick to the contract calendar. And then the contract calendar drives what's called impactable spend. So in the coming year, you may only be able to tackle 30 to 40% of your total contracts, because those are the ones that are coming up for renewal in the next year. And so that becomes part of your contract calendar, and then that becomes part of your impactable spend. And that impactable spend is what you're going to be targeting for trying to identify areas of improvement. So that's just one of those FYIs, good thing to know. You don't want to go in there because sometimes, like I said, I've run into people on the administrative side who will say, well, I heard of or read a story about how, hospital X on the East Coast somewhere or whatever, they just got a great savings on their, orthopedic implants for knees and hips. Well, that's great, but we just signed a contract 6 months ago. It's highly unlikely we're going to go back and break that contract at this point in time. You would really have to have an enormous amount of incentive to do that. And then the trouble is you're going to have to keep going back to them and renewing contracts anyway. So it's better to keep the one you have and then work on the next round. So just make sure people are aware of what's in the contract calendar and what's approachable and what you can impact. Once you get your impactable spend, though, break down your contract calendar by the committees determined in the workflow. And so now, if you just have one committee, it's all coming through that one committee. But like I said, typically, commodities, commodities committee. If you have new technology, you're going to bring it in there. If you have an area of physician preference items, you're going to want to look at what those are. And it's just my experience on any given contract calendar that may be anywhere between 30 and 50 items. You're probably not going to be able to take on 30 or 50 projects, and many of them actually may have already been previously established at lower rates. So what you may find is that in terms of what you're going to be approaching, you might have something more reasonable, particularly your first year, and you may want to only target a few to start with and then build up after that. And you're just going to have to figure out how many you can take on, how many you have the resources for. If you have a small team and there's only 3 or 4 of you who are going into and working on, developing value analysis, it might be difficult to go and tackle 30 projects that first year. It's just not technically going to be possible to squeeze that much in. I think for most people, it'd be really the exception if you could do that. And not only that, but if you could do that and demonstrate significant savings, then more power to you. But we were never able to get to that level of functioning in that short a period of time. So I would recommend that if you're starting this up, start with something that's realistic. And then go in and look at your list and rank that list from highest to lowest annual spend. And what you may find is that there's something that is not a real huge amount in terms of annual spend, but might be a great opportunity. And then there's going to be things that are going to have a lot of high opportunity in terms of potential cost savings, but may not be realistic. You're just going to have to rank it and sort of get a sense of. But I think you start with the highest to lowest annual spend and then break it out and start to earmark the ones that you think really are the ones that are worth tackling that year. And then prioritize your projects and start looking at them and use the contract calendar. If something doesn't renew until 11 months from now, well, there's no reason to start working on it today. But you want to do this process about at least a year in advance. And the reason is because if you have something in your contract calendar for the coming year, you want to start looking into it probably 3 to 6 months before you actually go and tackle it as a value analysis team. So setting your contract calendar is going to be determined by the contract year. So if it's June of this year, you probably want to start looking at the January through December contract calendar in terms of what are the projects you're going to take on. So there's a lot of foresight that has to go into it. And that's why I say that first year, it's really difficult to do this and have, the 30 projects or something like that. Mainly because by the time you get everybody together and get working on things, a few months will already have passed. And, try and particularly if you're going to involve physicians in this, getting them in as a group to sit down and look at a contract calendar or look at a particular value analysis team. It takes a little while to coordinate. So you have to think about this in advance and start to plan out what you're going to tackle in the next year. And you almost have to do that about mid-year of the year before in order to do it. So it's almost like an 18-month total lead time. And then every month you just keep renewing, keep looking at what goes to the next, the last month of the contract calendar, what's going to get added for the next month. And you just keep doing that. And once you get into the cycle of doing it, then you can be a lot more effective. We took on 3 our very first year, but we were able to do those 3 in the last few months of the year. And then we began our contract calendar going forward after that. So I think that's just a simple way to do it. It's the way we approached it. You can try it some other different ways, but I think that's actually a pretty good one. And then utilization. We developed an idea center. We just had a way of informing everybody in the organization that we were looking for any and all ideas related to supply chain or services and anything that could potentially save money. And had a group that vetted those ideas, a group that implemented those ideas, and then we'd scale them up across the organization. And it's interesting, people will submit an idea, maybe in their department it'll save like, $1,000 a year or something like that, but you scale it up over a pretty large organization. Next thing you know, you've got $100,000 in savings. That's literally what we were starting to see, was these small ideas can grow very quickly in large organizations. And that's the whole point of having an idea center, is to be able to develop those things. You got to screen them for high impact and high probability of success. Some people were putting in some ideas that really weren't utilization ideas, and that really, you just didn't see how that was going to lead to any type of cost savings or improvement in patient care, So you just have to have a way of screening ideas. And then the next step is how to scale them up. And so you have to be able to scale them up at a department, facility, and region and system. And so we had regular meetings, monthly meetings, where we would go over ideas that we were working on with various the supply chain directors and typically perioperative directors at each of the facilities, and talk to them about the ideas that had come in and how we're going to scale them up and how they can go about start working on them. So that was an approach that we took. I think it's a good idea to break them up this way and think about it, because it really kind of determines what your next steps are going to be with each one of those. So take a look at contracting and utilization. So you've probably heard this before. It's called SMART goals, and I alluded to this one as well. When you develop your goals, make sure they're specific, measurable, achievable, realistic, and time-bound. And so you heard me when I was telling you about that whole thing when you're talking to an administrator and they ask you, or you ask them, what does success mean to me? And they say, well, you'll be success if you save some money. Well, that's not very specific, not measurable. I could save 2 cents. Does that count? Well, is it really achievable? Is it realistic? Is it time bound? So narrowing people down, getting the more and more specific and measurable and achievable and realistic, time bound, is going to determine your success. And if it's going to determine your success, you want to be able to have a say in what those are going to be, those SMART goals are going to be. And there has to be some agreement on what is, say, achievable, or what's realistic, or what's a realistic time. You may be able to do something in 12 months, but doing it in the next month is completely unrealistic. So it's okay to call people on that, because you want them to be dealing with reality too, and you don't want them walking around with false expectations. And sometimes you just have to assert yourself and say that wouldn't fall under what I would call a SMART goal, and it may catch some people off guard, but at least it helps you understand what you're trying to achieve in very, very specific terms. So these are some objectives, and you're going to see as I walk through this. I've got examples of this, and I'm going to take you through this. And so performance improvement objectives, and I've got it broken down into goals, action plans, dashboard, results, assessment, and then recommendations. And where I'm going to take you through both, say, a value analysis program that has some very, very, is in the very, very early stages, so to speak. And then I'm going to very quickly move you into one that has a much more mature dashboard, much more mature goals, and so meaning more goals, and show you what that looks like. And just kind of be aware that that you're going to see it kind of change quite a bit, but I'm going to take you through each of these and look at their goals or action plans, the dashboard, the results, the assessment, and recommendations. And the reason is because all programs are different. Some are going to be able to take on a lot more projects, and then others, some are not going to be able to do it. And I want you to be able to kind of get a sense of how both of these work, and then sort of what can be achieved in the future for your program. So here's one. This is a relatively new program, and what I've done is I've actually had one template for all of this, and in that template, this just happened to be number 2 goal and number 2 action plan, but you'll see it later on in the more built-out version of this. So I tried to ignore that number 2. It really is just from how I pulled it out of the template that I had for developing these ideas. Oh, and by the way, this is another one of those that's in the startup kit, and I'll show you. It actually has both the list of goals and action plans and everything like that, and example dashboards. And so you can just send me an email and just say, hey, Terry, send me the value analysis program startup kit, and I'll send you that. I think it has like 10 documents in it that go into detail of various things that I think would be very helpful for you when you're first starting up your program. It has like a template for agenda, a template for minutes, and it has this one, which is the dashboard and things like that. But it also goes into sort of examples of these goals. You'll see all of these in this presentation, but I just want you to realize that if you want an actual copy of it, I'd be happy to send it to you. I'll send you the whole kit, and you'll have the copy of it for your own perusal. So here's an example of a new program. So they're sitting down and they come up with their value analysis program, annual goals, and action plans, right? They're just kind of like we were in our first year. That we didn't know what we were going to do. We just came up with some ideas and threw them out there, and we said, let's come up with utilization savings from the Idea Center, because we would like that. We had toyed with this idea of the Idea Center the year before, got some ideas, started to see some savings with it, and realized maybe we could scale this up. And so This is just an example. This is not the specific goals that we set for ourselves, but I want you to see this just so you can see how SMART goals can be assigned to any of these types of goals. So you start out with what the goal is. And so we have two goals here, 2A and 2B. It's to increase the number of cost savings ideas submitted by 50%. That's compared to the prior year. It's to increase the average cost savings per idea for ideas implemented by 10%. And so we're trying to generate more ideas, and we're trying to generate more cost savings per idea. And so we want to have really kind of high value ideas coming in. And so the action plan is we're going to implement an awareness campaign for the new ideas for our current staff and add it as education to new employee orientation. Because remember, new employees are coming in. They don't know the organization, and they don't know these things are available out there. So it's good to let them know that these are the types of programs we have. We also talked about, we could provide an award to the department with the greatest number of monthly ideas and greatest savings ideas. So we're incentivizing people at the local level to come up with it so they can take, the applause for a great idea or something that they've done for the organization. And people, that counts for them in terms of their monthly or their annual evaluations. And so kind of a way to incentivize them to want to come up with new ideas, and particularly ideas that save the organization money. And so we put this into place. We have a goal. We have an action plan for achieving the goal. And realistically, these action plans usually have a lot more steps involved in it. But I wanted to put something there that was pretty straightforward and simple. And you create a dashboard. And again, this dashboard is available in the startup kit. Just ask me for it, and I'll send you a copy of it. And so what you're seeing here is we created a dashboard. And so we wanted to look at cost savings ideas as the total number. And you see highlighted there the goals. What the results were for that year. And so the target was a 50% increase. You see cost savings ideas, they increased it by from 10 to 22 per month. So that's 124% change. That exceeded the 50% target. So it blew that one out of the doors. Well, you sometimes have to break these ideas down into sub concepts. And so here is it says we want to know what the average cost savings per idea implemented was, and that's in dollars. And you can see the prior year was 13.5 thousand, and this year it's about a little under 10.5 thousand. So that's a 23% change, and we'll talk about what happened there. Didn't meet target, came way short of it. And so the question is going to be one of why did that happen? And it's always nice to have these things broken down into concepts. And so here it starts out with a pretty basic concept, and that is how many cost savings ideas were accepted. So we know how many were generated, but how many were actually accepted? And you can see only about, we accepted a little bit more than what we did the year before. So the year before we only accepted 50%, and now we're accepting about 70%. So our acceptance rate has gone up. And then we look at the cost savings ideas implemented. You see the previous years, it was about 80% were implemented. Only this year, now it's down 32% were implemented. And so average cost savings per month for ideas implemented, that's the total number. And you can see there's only about a 3% difference. So in terms of total ideas, we're kind of almost break even from where we were last year. But in terms of average cost savings per idea implemented, it's a lot less. It's 23% drop. And so for those of you who are sitting there scratching your head going, this is confusing me, I hate spreadsheets. I hate, looking at numbers like this. What I decided to do was to take this. Now this spreadsheet is actually a reduced one. I've hidden columns and rows, and what I took away was what they were per month. And so in the following slide, what you'll see is I broke them down into just simple charts, just so you can kind of get a sense. And we'll look at these from left to right. And as you're looking at them, hopefully it's going to develop some ideas about what happened here. And so here you are looking at them. If the last slide with the Excel spreadsheet was confusing to you, hopefully seeing it as a graph clarifies it a little bit. And this is the nice thing about graphs, is they can show you things in your data that maybe you can't see just by looking at a spreadsheet. And so here's the number of cost savings ideas, and sure enough, monthly number of cost savings ideas went up. Just kind of was a little sawtooth there, but as a general rule, it went up. There's clearly a trend lines up. The cost savings per idea implemented, remember we broke that down by number of ideas accepted, number of ideas implemented. And we saw that the number of ideas implemented was going down. And so that's in chart 3. So you see this steep drop off in total cost savings ideas accepted that were implemented, and you see that the average cost savings per implemented idea is going down. So think about this. You're the person who's in charge of this program, and one person's saying, you've already sent out the campaign, you're getting all these ideas, and you have to decide how many are getting implemented, but you start to notice something. You start to recognize that the more of these ideas that I implement, the average cost savings per idea goes down. And so this is not an uncommon finding. Which happens is you start getting all these ideas, but they're all not real high cost savings. Maybe it's only a few $100s per idea on some of them. And all of a sudden you start looking at it going, oh my God, we were saving almost $14,000 per idea implemented. Now we're dropping off, and it's down to less than 10,000. What's happening here? What's happening is you're basically diluting your cost savings per idea purely because you're taking on more ideas, and a lot of those ideas don't necessarily have a high dollar price associated with them. And so you, as head of the program, now are starting to go, I'm not going to implement these ideas, because if I do, that's going to kill my performance for my goal number 2B. And so here we are, we're not implementing ideas purely because we have a goal that says that the average number per idea is supposed to be going up, when in fact it's actually going down. And as it turns out, the cost savings, had they been implementing all those ideas, actually would have had substantial cost savings. But that's not what we incentivized. We told people they had to do it cost savings per implemented idea. And so now you've got people now making decisions about implementing certain types of ideas because that's how they're getting incentivized. And so they're not listening or not implementing most of the ideas. And so you got a lot of ideas out there that are sitting on the shelf. And that's really probably not what you want to do. And so you just have to be aware of this. And I put this as an example so to help you understand that you got to be careful about the types of goals you set out there, because this, as it turns out, are two goals that are at odds with one another. You're trying to incentivize people with more ideas, but the problem is the more ideas they come up with, the more likely they are to come up with ideas that don't have as great a much effect on the savings per idea. And so you see that dropping off, and now all of a sudden somebody's no longer incentivized to implement any ideas. It's like, okay, well, we'll just keep the ideas coming in, we just won't implement them. And that's not helping your program out either. So just be aware of this. I put this in here as an example of the kind of thing that can happen to you when you start setting these goals, and just as a general awareness. And then we'll go into a little bit more, develop one here in just a second. But I want you to see, what the process is. You start with these goals, come up with action plans, and then you have to have a dashboard. But sometimes charts can help you explain ideas a little bit better. And so you also should do an annual review. And I would say it's probably more frequently than annually. It's almost like every month you'll be doing a review, but you should at least somewhere summarize what your review is. And you can see that we summarize it as results, and it's just basically taking that data and putting it into a statement. A number of ideas submitted increased by 124%, which exceeded the target of 50%. That's just a statement of fact, and that's how your results should be reported. The average supply cost savings idea worsened by 23%, which did not meet the target improvement of 10%. Again, just a statement of fact. Don't try to make anything out of it. Just put it down there. The assessment is awareness for the need for new ideas can improve the number of new ideas submitted. Clearly, you went out, you had an awareness campaign, and you saw the number of ideas going up. While the number of new ideas increased, chart 1, the cost savings per idea decreased during the year, chart 2. Again, just an observation. The percentage of new ideas implemented decreased during the year, chart 3. We have a problem. We need to explain it. So that next line or two better give us some idea of what happened there. And then number 5, cost savings per idea was greatest at the beginning of the year, suggesting the best ideas were implemented earlier. So maybe best, meaning the ones that had the highest dollar amount associated with it, were implemented much earlier. And those that had lower dollar amounts were implemented later. As the cost savings per idea decreased, the incentive to implement lower cost ideas was reduced, which impacted the total savings from cost savings ideas. And so you had this is purely, this is leadership decision making, and this happens. We're all going to do this, so don't think you're going to be able to avoid this 100%. But it's not uncommon where you start developing goals and all of a sudden realize a year or two later that, wow, maybe some of these goals were actually creating a problem for our program that we were just unaware of. And so the recommendations, and you should always have a recommendation once you made this assessment, because remember, you're going to be making new goals for the next year. Continue the new product request process. These were, I added it, and you'll see that what that's for in the next slide. But continue to support. This is getting back to the one that we were looking at. Continue to support the cost savings ideas project. Eliminate the cost savings idea per idea goal and replace this with total cost savings for the year. That way, people get incentivized to implement all of those ideas that are actually creating cost savings. And so, you learn from the process and you build it into the next year's goals. And it's important to make sure that that's the goal. You're trying to learn in the process. You don't want to go back there and say, well, we need to fire the person who came up with that idea. Get rid of them. That's not what you want to do, because that person just spent a year learning about this, and they're not going to make that mistake again. And you as a program shouldn't make that mistake again. And since leadership's signed off on these goals, they should be able to learn from it as well. So I'm not really into that, let's fire the person who came up with that idea. It really should be one where we go, oh, wait a second, we learned from this. We should feel proud of ourselves for learning for this. We tried something and it didn't work out the way we thought it was going to work out. So learn from your mistakes. Trust me. In fact, actually, if you've been through this program, you've been learning from my mistakes. So there's no reason why you can't learn from your own mistakes. So here's a maturing program, and again, this was the original one where I pulled the previous one out of. So you'll see the exact same thing for utilization savings from the Idea Center, but this is a lot more mature. And they've broken it out, and it's improved inventory management, utilization savings, value analysis team projects, and then total supply savings. And then has goals set for all of those. I won't go into a lot of detail in this one because I just wanted to focus on the previous one to give you an idea of how to do this. Again, this is also available in the startup kit. Feel free to contact me, and I'll send you a copy of this. The action plan, remember, gives a lot more detailed action plans for what you're going to do. And then it talks about each of the action plans for each of the goals and how you're going to achieve it. And you should, and people should understand that, these things just don't achieve themselves on their own. You have to have something. You have to be proactive about it. This is not a passive process. You have to say, this is what we're going to specifically do to improve our performance and achieve our goals. So have an action plan and stand by it. It was, I said the whole thing about Peter Fine, and he also had another aphorism, and this one was, plan the work the plan, and that was a big one of his. And his whole thing was, look, when you sit down and you come up with your goals and you develop an action plan, right? Plan the work the plan, use the action plan, and put it into effect. And if you can do that and you achieve your goals, now you've just learned what works. If you do that and you don't achieve your goals, now you just learn what doesn't work. That means the next version of this, you just change it and you try something different. And that's the learning process. And you have to understand that a maturing program is a program that's learning. And so when we were talking about succession planning before, you have to have a way of making sure that the people who are in succession for the leadership positions in particular, but also for the other positions in a program, are people who can learn as well. You don't want them having to go out there and make the same mistakes you just made. You want the program as a whole to learn and the people within the program to learn. So here's an example of this. Is the value analysis program dashboard. It goes into a lot more detail than you saw on the previous one. It breaks it down in all these little subgroups and subtypes of things in terms of, what are you trying to accomplish. And the reason is just like what we did in the last example, and that is sometimes you have to see how it's broken down and see where the problem was happening. How did you miss that? And when you see it in the data, a lot of times it points it out, and you go, okay, I can't believe we did that. But then in retrospect, that's how we learn. And so same thing here. One of the other things I wanted to point out, Tim, you can see where it says value analysis team projects, and I talked about this earlier, and that is that the program has to improve over time. And so here's an example where it was number of projects, and then we broke it down by number of projects completed, projects completed percentage, the cost savings per month, and the cost savings per completed project. And we're just giving examples, but you can see that the program is maturing because in the previous year they were only doing, basically it says a half project per month, so 6 projects per year. And then now we're doing a little over 2 projects per month. So now we're up to, 25 projects per year. And so that's a substantial improvement, 333% improvement. So the program is generating more projects. You could also see that the cost savings per month has gone up significantly. You see previously it was about $5,000 per month. And now all of a sudden we're up to $70,000 per month. And that's a huge jump. And that is, as a result of generating more projects and identifying projects that are really the ones that are really worth going after. And, that's a very selective process. But I think that that's, also has the same thing we were talking about before, in that one could have potentially ended up with a, cost savings per month per completed project that was actually less, because, all of a sudden you're taking on new projects. But I think for a lot of value analysis teams, you're much, much more highly selective than you are with, say, utilization ideas. Utilization ideas can be, what seems like a good idea doesn't turn out to be a good idea, or something that seemed like a relatively minor, when it gets scaled up, it turns out to be pretty big. And so utilization ideas, there's a lot more variability in that, whereas these projects you're generally a lot more selective about what you're going after, particularly if you're rank ordering them in terms of the annual spend. So if you have high spend and high savings, you can generate a lot more savings than that one. But it's important to understand the difference between the specific projects that you're taking on that are either achieving their goals or not achieving their goals, and then what the program is doing in terms of projects and then also cost savings. And I think that's important for you to realize, that those are important things to set up as goals for the program and be able to point that out to people. And this is one where you want to bring your C-suite and say, hey, listen, last year we were saving, $5,000 a month. We're now saving $70,000 per month. That gets people's attention, particularly the finance officer. And so you want to be able to impress upon them that the investment in this program is really well worth it, and that here it is, it's paying for itself in, very short order. Not only that, but I also think it's important to look at utilization in contracts. If you can break them out this way, we were able to do, we always assigned everything we did was either utilization or contracts, and pointed out where we were getting the savings from, and then also the supply savings per month. And you can see there was overall a pretty good savings. That's about 6%. For supply savings per month compared to the prior year, and that's so for supply savings, it's actually a pretty significant jump. And this is all in a sense theoretical. So this isn't numbers that I took off of our actual dashboard or anything like that, but it gives you sort of a sense of what is possible out there. And so here's just that annual review of goals. It goes into a lot more detail, and you can see it goes into all the results. Same thing, gives you all the assessment, and then breaks it out by the new recommendations for the following year. And so also, these would probably take up a lot more space on a piece of paper if you were really writing them out for your program, if it was this mature and you were taking on that many goals. But I wanted you to get a sense of what is possible out there and how to approach these types of projects. You want to be able to be assessing them. You want to be able to, they should always be generating something that you learned in the process, and therefore what recommendation would you take home with that one? And so these are just examples of how to do this. So additional goals, I've also heard, this first one was another one that I saw another program was using. They used return on investment. So they just basically, they looked at their value analysis program cost savings, and then they looked at their value analysis program expenses. So they actually had everybody who was part of their value analysis program, in a sense, were on the books. And, even if you were like a tenth of an FTE, they took that tenth and counted that as part of their expenses. And you could see what happens is, just an example, your ROI of 10, and that's actually pretty substantial. And so you'd have, say you had savings of $500,000, but it only cost you $50,000 to get that. Same thing. You want to be able to go back to your financial people, your CFO, your chief financial officer, and say, hey, listen, this program has an ROI of 10. How many programs out there do we have an ROI of 10? And the answer is probably going to be not many. And so this is always one that you really want to be able to point out. You want people to put your program on the map, make sure that people know it's producing significant outcomes. Here's another one, clinical outcomes. Now, we had a completely separate division that worked on clinical outcomes, but I want you to see how clinical outcomes can also impact supply outcomes. And so here's an example. We did an enhanced recovery program for bowel surgery, and there's the publication down there if you want to go and read about it. But what we found was you could also count readmission-related supply expense reduction. So say you just figure out what's the how many readmissions, or another one would be how many reoperations. What was the additional supply expense as a result of that? And if you come out with a clinical practice that changes say decreases your complication rate, decreases your reoperation rate, decreases your readmission, you can technically go out and calculate what that expense reduction is going to be and be able to count that if you wanted to. Now, some of the finance folks might have a problem with that, but I look at it this way. One of the guys said, he goes, well, what account, one of our CFOs said to me, Terry, what account did that show up in? And I said, it's called your run rate. And so a lot of organizations, when they set their budget, they'll base it off of the previous year's run rate. And so if I'm providing savings for you in terms of decreased readmissions or decreased supply expense because of changes we made in clinical practice, you're getting those savings in your current run rate, and then you build it into your future budget. So that's where the savings went. That's the account it went in. It's really hard to go back. Like a lot of times if you get a contract savings, you can say, well, I can see where it came from and exactly where that money ended up. But for clinical outcomes, it's a lot more difficult. So the CFOs of the world are a little bit more skeptical of the claims that get made as a result of clinical improvement. But for those who have done the clinical side of things, I'm not a skeptic. I can definitely see the difference it makes. And so it's really hard to get the accounting on it. But this is one way to do it if you wanted to do it. Oh, we did another program too, the patient blood management program. I also have the citation underneath there for that one. And we did this one with joint replacement. And what we found was we were able to decrease our packed red blood cell transfusions per 1,000 admissions significantly. It dropped a huge amount. And just to give you an idea of the kind of savings we had an estimated savings of about $725,000 for the year that this program was in place. And I think that's that you can count. But you want to, when you're building these goals for yourself and telling people about the types of programs you're going to be working on, you have to be able to make sure that you make room and set expectations around. And we will be counting, if we can decrease our packed red blood cell transfusions, we will be counting that as a cost avoidance. And so it's just one of those things to think about when you're setting your objectives. Now, in our organization, we had a separate division that worked on this. It was not related to value analysis. It was not related to the supply chain services. But nonetheless, they were out there performing this. And so you may be wondering, when I was explaining further about, well, how do you, when you're setting goals out, specific goals out there, why would I do this if value analysis doesn't normally do this? And I think what's going to happen, I think what we're going to eventually see as we get closer and closer to population health management, we're going to have to start meshing these ideas and bringing value analysis in on clinical performance as well. Why? Because I just think that there's such an overlap between the two, and my experience shows me that, and what I publish shows me that you're going to see these types of savings happening, and they can be calculated in there, and I think they should count. So your value analysis program actually can extend its range and scope by dipping into clinical outcomes. Now you're going to have to do that with a specific program, and that's a whole nother thing. I've got another. I know you're probably getting tired of me, sort of talking about other things I do, but I also have a book on how to develop a clinical practice program, and then how you can use your clinical practice program to generate not only improve outcomes for patients, but also improve savings. So these are all related. They're very similar. I don't think you need to necessarily buy that book, but particularly if you've been through all of this, you probably know how to start up a program for any type of program after pulling together a value analysis team and program and getting it highly functioning. If you go through that, you could probably do just about any program. So I want to point out something else. My dyad partner in supply chain and I used to refer to this as the opportunity tree. And the opportunity tree, as you can see, has different opportunities at different levels. Down at the lower level of the tree, the easy picking, so to speak, is where you see commodities. It's pretty easy to switch out on commodities. You get a better contract, you just switch it out. Most people don't even notice that the product's been changed, and if they do, they really don't care because it still meets the needs of their the patient care or whatever they're doing. If it's just simple as wipes that they use for wiping down countertops, they're probably not going to have a big deal in terms of what you choose for that, as long as it works and gets the job done. When you reach up and move into utilization, it's going to take some additional tools to do that. And so utilization implies that you're going to get some ideas in. You're going to have some process for vetting them. You're going to have some process for scaling them up and distributing them throughout your organization. And so those are a little bit more difficult to get in place. And sometimes you might get some pushback on some of them. But you should remember that it's going to take a little bit more to get there than it would, say, with trying to get savings from commodities. When you start moving up to physician preference items, that's a huge leap. And you're going to need a lot more resources in terms of what you do. And the resource in particular is, I think, a value analysis program really specializes, and that's your value analysis teams. You're going to have a way of coordinating them, having those meetings, setting up presentations, looking at various options, looking at the literature and what's out there in various physician preference items. And you're going to have to be able to coordinate and set up meetings with physicians. And it takes a different skill set. And so this is, as you go higher that opportunity tree, yeah, the fruits look a little riper, but you know what? It's a little bit more difficult to pick them. And when you get up to the clinical practice change, you're really going to need some resources. Like I said, we had a completely separate division that worked just on clinical practices. And you may find that that's what you have to do. You have to set up a completely different program just for clinical practices. And like I said, I've got a book on how to do that. And also the book comes with the same thing, a startup kit and everything else. So it's kind of nice that if you wanted to go in that direction, I've got a way to do it for you. But if you don't worry about it. But clinical practices, that's where a lot of the really, really important savings can occur. And as an example, we ended up writing a paper. We did this with total knee replacement, and what we found was that we were saving 1 year from the baseline period to the study period. By improving clinical care, we were saving $1,000 per patient. And we were doing over that time period about 3,000 knees a year. So that's about $3 million a year savings. And so it starts to add up to quite a bit of savings if you can do it and you do it right. And so I would strongly suggest that as your program matures, you start looking at clinical practice change as a way to get into some of these other areas that will give you more robust savings. And so you just have to remember the opportunity tree, the higher you go in it, the more difficult it is to achieve, but the more likely you are to find things that are going to produce much, much greater savings. And remember the other thing about clinical practice change is that particularly the one we did with enhanced recovery, we saw about a 28% drop in our complication rates, and we saw almost an 18% drop in our readmission rate. So in those in particular, you're not just getting cost savings, you are improving patient care. So to me, I think the very top rungs of this tree are really where we ultimately are going to end up having to go for all of our cost savings in the future. So I think that's where the world is headed. And right now with value analysis, we tend to focus on utilization and physician preference items. But the higher rungs of this tree are going to be the hard work, where the real heavy lifting is. And so eventually we'll have to get there. But in order to get there, you have to have a highly functioning value analysis program in place that can now start to incorporate those types of clinical practices and get to that point. It takes a lot of work, takes a lot of time and energy to get there. So when you get there, having been there, I can tell you it's well worth it. It's probably one of the most rewarding things I ever felt in my career was to see that type of improvement across a large organization and to see that we're helping so many people and getting cost savings at the same time. So this opportunity tree is something to keep in the back of your mind. You're ultimately going to want to get to the higher rungs of that tree. So with that, let me just tell you a few lessons that I learned along the way. Learn from your mistakes. Don't penalize leaders who are learning. Now, if they're not learning, obviously, then that's a whole nother discussion. But if they're learning, let them learn. Let them figure out ways to, okay, we made a mistake here. What are we going to do next time to make sure we don't make that mistake? Because as they're learning, they're actually adding value to your organization. And that's why you want to have a succession plan in your program, because when people leave, you want to make sure that the program learns and continues to learn and doesn't make the same mistakes. And so penalizing leaders who make mistakes and throwing them out, like, well, they made a mistake last year. They set up a stupid goal. Well, they didn't know at the time, and everybody else signed off on it. Couldn't have been too stupid at the time. So now all of a sudden, maybe you learn the hard way. Okay, that wasn't such a great goal. And so you learned. So what? You learn. Learn from your mistakes. Don't penalize people for just because they make mistakes, particularly when half the leadership teams are signing off on these mistakes. As long as they learn from it, that's okay. Develop goals that complement one another. And I gave you the one where they didn't complement one another. In fact, actually sort of antagonize one. As you made success in one, it was actually creating problems in the other one. So you have to break these goals out and start to see, are there other components to this goal that might develop problems in another goal that we're setting. And so if there are, then rethink how you're going to set up those goals. I would say ultimately you have to take on quality projects that complement the cost savings and utilization projects. And like I said, we were looking at clinical practice change, but it was a completely separate division. It wasn't aligned with supply chain. It wasn't working with our value analysis program. I was fortunate enough to have lead positions in both at various times, and was able to see it from both sides of the fence, so to speak. But we were never able to bring it together into a one unified whole. I think ultimately we're probably going to have to do something like that in the future. But I think that for those organizations that have figured that out, you're probably few and far between, but more power to you. For the rest of us, though, that's probably where we're all headed, and we're going to have to figure out how to get there. But I think having a sound value analysis program is really a good positive first step. And then also starting to work with people who do want to develop clinical practice change across the organization. And then also the last one, create a process to continuously improve. And so that's what I was saying about the program. The program has to continuously improve in some way or shape or form. And it may be, you've maxed out on the number of projects you can do in any 1 year just based on your size, your organization, and the number of people you have in your program, who are part of your value analysis program. And so now all of a sudden, maybe it's something different. Maybe it's like, well, how do we start working with folks for clinical practice change, And that's how we continuously improve. Remember, your program's going to change over time. And as it does, you're also going to see the people who are involved in it change over time. And so that may become something that, 5 years from now becomes also all of a sudden possible. Whereas right now you're thinking, that's impossible. We would never be able to do that. And then also your program matures and you begin realizing, hey, we're going to need to move in that space here. And now it becomes a possibility. And then a few years later, all of a sudden, it's not a possibility anymore. It's practicality. You are doing projects in there, and you're learning from those projects. So always have this process that you're going to be continuously improving in some way, shape, or form. And that's the way to do it. So I also I do some supporting material, and I've mentioned this many times. I have the Value Analysis Program Startup Kit. You just send an email to me in my email. You'll see it on the final slide. Or you can just go straight to my website, and I have it in a contact form. But just send me an email and say, hey, Taylor, send me a Value Analysis Program Startup Kit. I send it to you. It comes as a zip drive. You open it up. It'll have 10 documents in there that can help you get your program up and started. And a lot of the documents I've talked about in this program. So these are things that you can just get right off of the electronic shelf, so to speak, and start using instead of having to go and create them yourself. And so I think sometimes people use that as a barrier, like, well, we don't have the materials. It's like, no, I'll give you the materials. Here they are. Go ahead and start it up, and this will get you going. I also have Value Analysis Program books. They're a print edition. They're print on demand. You just go into, you can go to lulu.com. You can go to Barnes & Noble. You can go to Amazon. They're all out there. If you're an EPUB reader, then you like ebooks, then you can get it as an ebook, and they cost, as you imagine, they cost a lot less. And you can, literally, I was looking at it the other day on Amazon. I think the books now are, I think they're like $9.99. And I thought that they had one of them marked down to like $8.99. So this is, this is not a real costly program. You get a free startup kit. You get a book for, $9.99. It's really not a lot. I do provide some mentorship program for physician leaders, and the details of it, just simply send me an email and say, tell me about this, what can we work out? And I just simply work with you to help you develop your program. It could be, pretty straightforward, or it could be a much more complex relationship. But most of the time, it's generally pretty straightforward. I think most people, once they've kind of either read the book or been through this program, have a pretty good idea of what they need to do. And they just get it up and start working it, because that's actually how you learn is by doing it. You can only read so much, and there's only so much I can tell you over the phone in terms of how to improve your program. But I think you really ultimately have to do it yourself. But you got to have some sort of head start, and hopefully this program gave you a little bit of a head start. I also have other programs. I've alluded to both of these. The robotics program, the clinical practice program, same thing. They both have startup kits. They have books that are available, and so you can go and my website at www.loftushealth.com and get access to the supporting material, courses that are available, and also obviously the books and links to the books and things like that. So feel free to go there and get more information. And I really hope that you're going to have a lot of success with your program. Having develop a program, having learned a lot of hard lessons along the way. I hope you learned from my hard lessons. I hope I've been able to articulate them in a way that you can take it forward and realize that things that you can avoid doing in the future, and things that you should be doing that'll increase the probability of you having a successful program. Because that's ultimately what I want to see. Is my goal of this program is obviously to help you develop some sort of standardized approach for developing programs. In this particular case, it's a value analysis program. But I ultimately want you to feel like you are now empowered. Once you've done this, you're now empowered to go out and develop programs. And if you leave where you're currently at and go somewhere else and they ask you to set up a value analysis program, you can go, yeah, I could do that in my sleep. I've got a little template in my head about how to do this, and I'll put your program together. Or you're asked to create a different type of program, maybe a robotics program or a bariatric program or something like that. And you go, hey, I don't know specifically how to do that, but you know what? I've got a template in my head about how to build a program. I have a pretty good idea what I'm going to need to do and what types of answers I would need to have for any questions I have along the way. So remember, you can always send me any questions, comments, concerns. If you have any ideas for my programs, please feel free to send them to me. Happy to attribute ideas in next versions of any of this works that I create. But the simplest way to get a hold of me is through my email, terryloftusmd@gmail.com, or visit www.loftushealth.com. And that's it for this program. And thank you very much for listening. And I hope you have great success with your program and have a great day. Bye-bye.